What does a pharmacist do? Well, most people might answer that a pharmacist dispenses the medications that my doctor prescribes. Now, I work with a ton of great pharmacists, and one thing that I don't generally see is excitement about pills in a vial. And this is probably because pharmacists have been trained to do so much more. So what can you get excited about in your community? To find out, let's go beyond the scripts. Hey everyone, welcome back to Beyond the Scripts. I'm your host, Will Tuft with Pioneer RX, and today we have a special guest and familiar face joining us from the state of Florida, and you may know her from the Florida Pharmacies Association, your Florida CPESN, your American Pharmacists Association, various award recipients, Theresa Tolle. Thanks for joining us.
Thanks, Will. It's great to be here with you today.
So you are one of those guests that I could definitely spend a couple hours talking on multiple different topics and really just dive into one of those. So within those many, many hats that you keep on the rack, one of those is a business owner as well with your own pharmacy there in Sebastian, Florida. So tell me a little bit about Bay Street.
Sure. So Bay Street Pharmacy was founded in 1984. By my father-in-law and a partner. So I was fortunate to marry into the family a decade later. And then my husband and I started here in 97 and then we bought in 1999. So it's the 24th year that I've been here as an owner. And again, we celebrate our 40th year next year. So Sebastian's a community of about 35,000 people. And it's, we feel like we really are a part of that, very active and involved in many organizations locally too, Chamber of Commerce, a hospital. So very, very plugged in.
Wow, interesting. So I've heard of Sebastian, Florida. I'm surprised it's only 35,000. You would think a community that size would for it to be on my radar. Normally it's, a bigger town. So it must be something special about that town that's made it stand out because, like I said, I'm a few states away and I'm familiar.
So Sebastian is known for skydiving, for one thing, because of the beauty. We're right on the Atlantic Ocean, really close by an intercoastal. Also, we have an inlet here, so it's known a lot for surfing and fishing. So maybe one of those things.
Maybe I all of that sounds like a lot of fun. So maybe it's just been on my vacation wish list for a while.
It's quiet, but it's great. I grew up in Florida in a small town in the Florida Panhandle. So I love Sebastian because it feels a lot like the small town I grew up in.
Awesome. So tell me a little bit about your entry to Bay Street Pharmacy. So, marrying into a pharmacy family, was that something that you and your significant other were entering into together, or were you already kind of in another pharmacy and decided to make that leap later on? How'd that kind of all come together?
So God's divine intervention. I worked for chain pharmacies when I first got started out of pharmacy school and quickly decided that isn't where I wanted to be. My first job was in an independent in my hometown, and it was kind of my first love, but I guess I wasn't quite convinced I knew how to get started in that. So I was working for other independents when I met my husband. And then because of a variety of circumstances, I started working here first part-time. And then the partners approached me and said, we really want you to buy your father-in-law out. So I did that first. And then the other partner retired about 6 years later. So I think deep down, I knew I always wanted to be an owner. But I guess, initially it seemed like a really big hurdle when I first got out of pharmacy school, and I didn't make the effort initially, but it was all laid out for me. So that was a big blessing. Certainly a lot to learn though. It's a lot of trial by fire, and anybody who does it will tell you that. So I know this group I'm speaking to would absolutely agree with that.
Yeah, and that's one thing I've kind of learned through this podcast is that, there's definitely more than one road to ownership? Because I've talked to pharmacists who, went right into that kind of position through family or through, relationships, like from school to ownership almost. And there's definitely something to be said for, those different experiences. And, so many of the pharmacists and technicians I talk to here have spent time in chain environments or hospital environments, and again, everything you see in the long-term care environments, you can kind of bring that experience with you into ownership. So when you kind of moved into the ownership position, pharmacy opened in 1984, did things much differently than even in 99 versus 2009 or 2019, or even the difference from just a few years ago post COVID is pretty remarkable. So what were some of the initial challenges or initial opportunities that you saw as a new owner in a long-standing pharmacy?
Yeah. I think one of the things I spent time doing is learning. We did a lot of durable medical equipment at the time, so it was a pretty significant part of our business. So I spent time understanding that because I had never been done anything with DME. So that was kind of what we initially focused on, and did a really good job with DME for a while. And then competitive bidding came in for Medicare. And that really hurt our ability to be very effective with DME because it was very hard to compete in that environment. So that has definitely subsided. But that's one of the first things that I did, and just making sure I had a good handle on the team, understanding the HR part of it, which is difficult too when you come into a business and you haven't been the owner. So definitely getting a handle on that. Those are the first couple of things. As far as what I implemented, I really wanted to make sure that we were counseling patients on a regular basis on their new and refill prescriptions. It was something that I had always wanted to do my whole career, and it was really hard to implement in a chain environment. So that's one of the first things that we did. So we just make sure we had appropriate staffing to do that. That's harder to do these days than it was at that time.
And so I actually heard you talk about that in another podcast where you kind of mentioned that you have that, dedicated focus on counseling, because in most pharmacies, your point of sale team member is going to ask the patient, do you have any questions for the pharmacist? And move right through. And 9 times out of 10, that patient is just going to say no and, kind of go with the cadence of the conversation. But it sounds like you've made a concerted effort to change that cadence. And when the pharmacist is automatically taking that time, do you find that, oh, that patient does have questions? Once you open that door, do you find that conversation is generally like, no, I don't need consult, or, are they happy to have that interaction?
Oh, I think for the most part, they're very happy to have that interaction. And I think that it really just helps so much with the relationship building with patients too. So I mean, many independents have great relationships with their patients, and they know people by name. We know people by name. But yeah, I think in some cases you have to train them. It also depends on where they came from. So if we've inherited patients from chain environments, they're not used to it. And many times they'll say no, or I've been on that for years. And we're like, yeah, we know that, but you're new to us, and we just want to make sure you understand it. We want to see if you have any problems with it, if you have any questions about it. So yeah, that's one of the things that we've been trying to do. And then of course, as we've come on with Pioneer and had the ability to document in e-care plans, and also participated in CPESN Flip the Pharmacy, trying to be better about documenting that too. I mean, ultimately, when we have those interactions with patients, we want to document those interactions. So we really do have like that chart on a patient. And my hope is that many of these services are eventually going to be billable, because we're doing these interactions all day, every day, but we're not getting paid for them. So taking the time to document what we're doing is important.
Yeah. I mean, again, that's a conversation that comes up over and over and over is kind of that, that dichotomy of getting paid for spending the time with your patients, but how do you quantify that? How do you present that in a way that's billable? And it's really interesting to see some of those opportunities. I know CPESN has been on the forefront of kind of, working with payers to get some of those opportunities up front to where, payers can see a quantifiable explanation of that time spent. And we've seen other ways in the past too, even through like MTM actions, where there are those opportunities. But where do you see that going in the future?
Well, I think that payers are very interested in those relationships that we have with our patients. And I think if COVID taught us anything, and it taught us a lot, it is the importance of that local healthcare. So what I'm starting to see with payers that we have conversations with is they have a hard time touching the patient. Um, if patients aren't compliant, it hurts them. It hurts their HEDIS measures, and yet they need somebody who has that relationship with the patient. So I hope that we will start to see that payers really will rely, especially on independent pharmacies and that valued relationship, because we can actually get to the patients because we know them, and they trust us, and they're in pretty routinely. So I really we are seeing that a little bit more and more. So some of the contracts that are coming our way are a lot around doing that, almost a transitions of care model to begin with, where you just come in and you do that comprehensive medication review, you try to synchronize their medications and get them on adherence packaging. And they're paying a larger amount of money up front to do that. And then they're looking at paying like a monthly fee just for the pharmacy to be in touch. So almost a per member per month type of model. Um, I I don't know how long that will last, how many of those types of contracts will come along, but it does seem like payers really are very vested in pharmacies that have those relationships.
Yeah, I mean those touch points are so valuable, and you're not getting that anywhere else in healthcare. It just makes sense. Sometimes I wonder, we talk about, so many changes and provider status. And if you look at all of the things that healthcare is paying for, does it seem like sometimes instead of kind of redefining the pharmacist role, do we need to redefine the billing mechanisms for so many of those services? Because if you put everything into, erase all the lines from part A and part B and part D and just put them in two columns of, preventative care and disease management and then hospitalization, that hospitalization column is still way more expensive. And so many things in that first column can be done at the pharmacy level.
Right. Yeah, Medicare in particular hasn't been great about paying for preventative medicine or preventative services over the years. So I agree with you. I think that utilizing the pharmacist just really has so much opportunity. And yeah, I think payers are starting to see that. I'm hopeful. I'm very much an optimist. So you're going to hear that in me today. But I'm very hopeful that that payers really are starting to understand that we can make that difference. I mean, it's been demonstrated over and over. We don't need more studies to prove it. We just need those opportunities to come to us. So through CPESN, I'm obviously the lead Luminary in Florida, but watching what CPESN's done across the country, watching these various contracts that have happened in other states, and the types of savings that have been demonstrated to the healthcare system is very encouraging to me. And I really do believe that we're starting to see a trajectory of increase in that, getting to the point where patient care services is enough to support our bottom line. I don't think that's going to happen in 2023, but I think we're on the right path. And I do believe that in the next few years, more and more of these are going to come our way.
Yeah, I'm also painfully optimistic sometimes when, even I forget which test it was. One of the personality pie chart tests that groups take. And yeah, I'm sometimes overly optimistic and but I also seem to I feel like it seems that the tides are moving in the right direction. There's so many great opportunities in that arena because it's such a value proposition for that the pharmacy brings to the table. Um, asking somebody to help you or to pay you is always hard, but when you're offering to help them and really make a big impact on the bottom line. It seems like a no-brainer. It's really coming down to groups like CPESN who are helping to get that organization to make it happen.
Right. And I think hopefully most of the audience knows what CPSN is, but the biggest differentiator with CPSN is that it is a clinically integrated network. So we can represent all of our pharmacies to a payer and say, you can come to our network and these pharmacies will perform these services. Um, Otherwise, you really can't congregate with other pharmacies and do a contract because unfortunately there's laws against that in the US, but that's that differentiator. And then each state has their own network and the number of pharmacies varies. In Florida, we have about 120 plus pharmacies that are members right now. But across the country, there's 3,500. So if we have a payer that wants to do a nationwide contract, I mean, CPSN's like a small chain of
Yeah.
pharmacies across the country that they can do that contract with, and by being clinically integrated, there's quality that's a part of that, and we promise to be similar in the types of services that we offer. Obviously, independents are always going to be independent, so we're going to vary a little bit. But as far as the types of services, we have service sets to say this is the type of service that we will offer.
Yeah, that's definitely an important aspect. If you're talking to payers, it's real easy to show how great Bay Street Pharmacy is. But when you're talking about payer contracts, you definitely need to have more than Bay Street Pharmacy on board. And the CPESN groups, again, like you said, having those state opportunities, but also that national level opportunity. The other month, I guess it was last month in April, I made it to the mid-year Luminary meet, and it was so great to be there and just sit through all the classes and listen to all the great ideas and just how passionate everybody in that group is. So definitely, if you're not involved with CPESN, definitely missing an opportunity to be part of a big movement.
Yep, I agree with you completely. I missed that meeting this year, but it is always kind of mind-blowing. And again, for those of us that are optimists, it's super encouraging to see the potential that is there, and other opportunities that could come along.
So within CPESN, there are certain enhanced services that need to be offered, throughout the different networks. In that regard, what do you think is maybe an enhanced service traditionally that's no longer an enhanced service? It's an essential service you need to be doing, and if you're not doing this, you're behind the curve.
Well, I think the piece I mentioned a few minutes ago is really important. So I think the whole concept of medication synchronization and medication reconciliation, and doing the adherence packages. So that's kind of all together. Um, we require medication therapy management as well, although I think most pharmacies are probably doing that. But even in my own pharmacy, we're taking baby steps towards really getting patients synchronized. But it is amazing, even with baby steps, how much more efficient we are. And I'm sure one of the things we might talk about today is the coming DIR stuff, or the things that are happening with changes in the profession. But I mean, as we're trying to think about 2024 and what might happen, and really be watching our pharmacy's cash flows, I think that the more efficient we can be, the better. So taking those steps, I think, is essential. Yeah. Not, not just something that needs to be part of the service set, but we really need to be doing that.
Yeah, that's one of the keystones that, we talk about in every educational event and every podcast. It's always coming up. And if you're not MedSync, you definitely need to be moving towards that and leveraging your technology to do so. There's a way that you can do it that doesn't make life easy. And, you definitely want to make sure you're leveraging your technology and it should make life easy. But when you look at a patient with, 4 or 5 medications, and each one of those medications, you have, the patient calling in for a refill. You're moving that prescription through data entry, fill, verification, will call, notifying the patient, having a point of sale transaction or delivery. That's 7 different touch points on one prescription. So with 4 prescriptions, all of a sudden you're up to 28 touch points. It's hard to decide which one of those 28 touch points is going to be the one where you get clinical and concentrate on a med rec and concentrate on, really moving the needle in other areas. So definitely that MedSync is so important.
Yeah. And I think it gets to that appointment-based model too. And then that chance to have that interaction with the patient to see how they're doing, right? To get information from them about how are things working? Are you having problems? And by scheduling that every month, then you're definitely going to have that conversation with them. So I agree. I'm glad you touched on the technology part, because one of the reasons we are still baby stepping with MedSync is because we have tried and failed with other systems in the past. And it was very frustrating. And then it's hard to convince your team, okay, we're going to do this again. But it is working now. And we're very pleased. It does take patience though. So for anyone who is just getting started, let's encourage you that don't give up. Don't give up. Like the beginning is probably one of the hardest times. So just, set a goal, 5 patients a week, whatever it is, set a goal and just keep persisting. And there will be patients that fall off that program, and that's okay. You're going to have failures. That's okay. Not every patient's a perfect candidate for sync, but keep it up.
Yeah, so there's definitely a point where it tips, where it goes from having a difficult change, because any change is a challenge. So there's a point where that starts to pay off at a certain percentage. When you get around 25, 30%, I guess it starts to all of a sudden clear the schedule a little bit. So when you do have that appointment-based model, what benefits does that give you practically with the patient? Like, how are you capitalizing on that appointment-based model, and what services are you able to offer in that appointment?
So one of the things you could do is if they do have a medication therapy management opportunity, then that's a great time to catch them then. And do that. Also immunizations. And I will be honest that we're not as good at that as I wish that we were, but that's a great chance to, speak with them about what they're current on or what they might need to have. So those are just a couple of examples of things that, you could add in at that appointment-based model. But I also think just having that question, are you doing okay? Is there anything going on that we need to know about? Because, we can make an impact in their care that way too. Perhaps they do need a change in medication. So, that's the chance for the pharmacist. If the technician who's calling finds out that there's something going on with that patient, then that's a handoff to the pharmacist to have a little bit of a deeper dive as well.
Yeah. And those deep dives, that's what's so challenging to understand, why there's not more compensation for that kind of effort. When you think about what's covered by payers and what's not, like the idea that, the patient is covered for Ozempic, but not for a spin class. or covered for diabetes medication, but not an hour of time you spent with that patient over the course of a month, checking in on them and coaching them and all of those things. So it's going to be interesting to see how that continues to evolve. But one of the
I thought of
things,
one more thing. I'm
sure,
sorry, and
yeah,
then I'll let you go into your next.
no,
Um, Another area that is starting to emerge is social determinants of health. So, because you just touched on that, and maybe that's what you're going to ask me. But I think that would be another thing. We haven't really started doing that well, but I think we're going to, and I see that emerging for pharmacies as well. Because there's reasons, and I can think of one patient I have right now that is, I guess he's my project, if you will. But so many social determinants of health going on in his life, and things I try to help him with, but one of the components of it is mental health too, and and him choosing to accept that he needs to get some help as well. But I think that's another area, like not just asking how are things working, but if the answer is they're not, then trying to find out why. So I do think that we're going to see more and more where us as pharmacy owners are going to have a chance to really help with the social determinants of health. And I think there are payers out there for that. And that's probably one of the things you heard at mid-year too. Well, that seems to be a direction that CPESN is moving.
Yeah, because I mean, that's where you can really get down to the root cause of so many health issues because, oh, I have a gastric medication and a an antidepressant, and it's those are linked because I eat when I'm lonely, and there's so many different ways that you can really turn that patient's health around if you understand their lifestyle and those social determinants. Some of those challenges, especially in small communities. I remember one of our early podcasts with Joe Williams. He told me a story about how he actually went to one of his patients' house to cut down a limb that was blocking their driveway because that was a social determinant of health that was affecting that patient's ability to be mobile. But there's definitely not a SNOMED code or a billing code for removing tree limb.
There might be now. They've added so many, but no, you're right. Yeah, you're right.
So how do you see your team kind of acting on those social determinants? Have you taken that leap into what's the term, social health workers, or have you community health workers? Have you been able to task your delivery drivers with being more formally aware, or is it more kind of just a personal touch at this point?
Yes, we have not launched into community health workers yet, but that is something that we are definitely exploring. And again, it is an initiative of CPESN as well. So we have signed up to learn more and to start doing some of the training, but we haven't started doing it personally. At Bay Street, as far as a formal community health worker, I did mention the one patient, and I'll just tell you a quick story about him. So he has trouble with his car. He lives alone. It's not such a long story. He's not Medicare age. He's only 64. But my husband and I have gone and picked him up and taken him to his doctor's appointments to ensure that he gets there in time. I called him the other day and he told me again his vehicle wasn't working and he had to reschedule his appointment. Like, please remember we're here. But then he told me, I said, what about groceries? What are you doing to eat? And he said, oh, I'm doing takeout. I'm just sitting for food all the time, pizza and subs. This guy has kidney failure and congestive heart failure. Like, I'm terrified for him, but it's so hard to get through to him that he needs to do something different. So again, you can only do so much, but I think in some ways we do a little bit of that community health worker thing anyway. And that was my point. But we're not doing it formally for a majority of our patients yet. But we really do want to move into that. And I'm so appreciative for Um, Trip Logan and others who have really just set the standard as far as community health workers, because I do think it's a huge component of healthcare and an area that pharmacy really should embrace. Again, because of those relationships.
Yeah. Yeah. And it's, it really is great that, organizations like CPESN and NCPA have been able to create standards that allow you to now have an official title for what independent pharmacies have been doing forever. When Miss Smith walks in and you ask about, her family and her hobbies and her life outside of that prescription, that's really what you're doing. That's what independent pharmacy has always done. So it's great to see it, formally recognized that, and to help even advance that. So with, a lot of challenges there with billing still, but a lot of opportunity. Another area that independent pharmacy has definitely had some pain points is with reimbursement. And you mentioned that it may be a little while before clinical services are enough to sustain a pharmacy. It's been a little while since reimbursements have been enough to sustain a pharmacy as well. But Florida has recently had some positive action. So tell me a little bit about the Prescription Drug Reform Act that Ron DeSantis just signed in.
So I cannot say enough about the independent owners in Florida who have helped champion that bill and all that they did to fight it this year and go and testify. There were so many. Kevin Duane, who is in Jacksonville, leads our Academy of Independent Pharmacy, and Eric Larson. They really fought, but there were so many others, and I just want to give a shout out to many of them. Unfortunately, I wasn't able to be as present in Tallahassee this year because of my role with APHA. Although I was fortunate to get to go to the bill signing ceremonies because it was kind of nearby, so that was exciting. Florida got fortunate that the governor decided to champion this. So Ron DeSantis did indeed take this up as one of his initiatives that he wanted to push through, and that really helped give us the momentum that we needed, because anytime you're fighting for PBM reform in your states, you're always going to have a lot of money that comes into your state to fight you.
Sure.
And that indeed happened in Florida. But because it was the governor's initiative, then the PBM, those who were fighting us, were not successful. So the bill is really comprehensive, and we feel so fortunate. Hopefully it won't be challenged legally. I don't know what's going to happen with that, but it actually does eliminate DIR and GER fees. It stops steering. It has MAC reform. I mean, it's got a lot. It has a lot of details in it, and we really feel like it's one of the strongest bills in the country. So again, just a huge shout out, Florida Pharmacy Association as well, and FSHP, the Florida Society of Health System Pharmacists, also helped us with it, and just so many other buying groups and organizations that came in and sent lobbyists in to help us. So I'm sure I'm leaving some people out, but I want to give a shout out. So many independent pharmacy owners that stepped up, gave money, drove to Tallahassee to testify. It was just an all-out effort, and it's a really big win. So we're super excited.
Yeah, it's so exciting for anybody not in the industry. There's been so much talk about healthcare and healthcare expense and how, as a, most developed country, we should have free healthcare. We should have organized healthcare. The government should pay for healthcare. And we shouldn't pass the bill on to the government. We need to figure out why that bill has been so high and so insane and reform that billing mechanism, not just pass the bill to someone else. So it's really exciting to see this in Florida, where some of those big problems are being addressed. What do you think that's going to look like practically as an independent pharmacy owner, when you're looking at your reports this time next year?
Well, so it goes into effect in January. I can't even imagine what it would be like if DIR fees were eliminated. Um, so I mean, I just added mine up for the first quarter, and I won't throw out numbers, but it's terrible. So it would be a lot of extra money in my bank account. And as I already alluded to, January is predicted to be a tough month, or the first quarter of next year is predicted to be tough because the DIR fees become prospective. So we are going to already see changes, and then we're going to have to pay the fees that are remaining from the last quarter of 2023. So I'm not sure I know exactly how it's going to impact, but certainly it's going to be less money that we're having to spend or to send somewhere else. And there's going to be a great level of transparency. Now, some of that may be that pharmacies are really having to monitor what's happening and document and file complaints. I suspect that that's going to be one of the ways it's going to need to be enforced. Because I don't think that PBMs are just going to automatically comply. I think they're going to require us to be monitoring what they're doing and fight them.
So it sounds like there are definitely some great things on the horizon for Florida pharmacies. I know so many pharmacies right now are preparing for what we call the DIR apocalypse. So if you're outside of the pharmacy industry and you happen to be listening, DIR fees are traditionally paid quarterly. And then in 2024, I guess in January, it's going to switch to a real-time DIR payment, which means you're going to be a little bit cash strapped at that beginning where you're paying current DIR fees and then paying that previous quarter. And so for Florida pharmacies, much less of a burden in that regard. Do you see things, happening on a national level that are trending in that same kind of space, or is this kind of an isolated productivity here?
So I think one of the things we've learned legislatively is that we try everything at the federal level. So there's a DIR bill at the federal level. There's provider status we've been fighting for a decade. But those things take time. With Congress. So I think that many states are trying different things. And I know that some legislation has passed in the various states. Again, it's hard to tell what's exactly going to happen with DIRs in Florida, even in January, because they were coming up retrospectively. So I don't know how that prospective part's going to work. Because part of the reason to reduce it is to help patients. So I don't even still completely understand exactly what's going to happen, but I know bottom line, it's got to be better, especially with some of the reforms to like the payment model, the MAC reforms, and then the transparency. One of the pieces is that they have to pay all pharmacies the same as they pay the ones if they own them. So that's a very interesting piece. And even that it's supposed to eliminate spread pricing, which could be a really big deal. So I think that what's trying to happen is that many states are trying to put in this same type of language into their state acts or legislatures, while we do indeed have language for DIR reform in Congress, just knowing that sometimes it's years to get that type of language passed. We do have some champions who really believe in independent pharmacy and are fighting for us, but it does sometimes take a while.
Yeah, it seems like it's a work of fiction that fighting for transparency is so problematic when that's really key. Once you have transparency, it's fairly obvious where many of the problems lie.
Yes, exactly. And that's been one of the biggest problems with the PBM industry overall is there hasn't been an oversight. In most cases, they're not licensed or regulated in any way, shape, or form. So trying to get that built in and sometimes just doing it at the grassroots, state by state, is ultimately what will get the momentum to allow things to be passed. in Congress. And that's some of what we've seen even with provider status for pharmacists. I know there was a bill that passed in Maryland last week to give pharmacists provider status. Many states have passed that. So we're hoping that that eventually bubbles up to Congress as well. And then again, Florida passed like test and treat legislation a couple of years ago, which has been a big deal and something that we have implemented. And then the PrEP Act gave us that. But then we have this bill in Congress right now called ECAPS that we are trying to get passed to continue that authority for pharmacists to order and administer vaccinations, testing, and through the same authority that we had under the PrEP Act.
Yeah, so that's something that, you can definitely find articles and headlines on now, or, some of those expanded capabilities through that PrEP Act. How broad are some of those for the pharmacy? Moving forward, if some of those are able to stay in place, what exactly would that allow pharmacies to do outside of COVID?
So flu, strep, RSV testing, and then those and in any type of treatments for that as well that exist. So with RSV, for example, there is an antiviral that can be administered at this point. So pharmacists couldn't order that, but pharmacists could order Tamiflu or could order an antibiotic for strep, in addition to COVID, which is included in all of that. But there is a new RSV vaccine that just was approved, and pharmacists have the authority to administer all the vaccines for those that are available as well. So I think that one of the things American Pharmacists Association is looking at is perhaps adding the RSV vaccine to that list for that bill that's there. So yeah, just being able to continue that, because I think we haven't really talked about it, but pharmacists did so much through the pandemic, right? Through all the immunizations that they did, and our pharmacy was super busy with those. And then a lot of testing too. So we did a lot of testing for COVID and prescribing treatment for COVID. But being able to expand that and just really make a difference in the communities, especially when it's hard to get in to see perhaps an urgent care or a primary care. And just having pharmacists be those touch points is a big deal. And we've asked for provider status for years, but this bill, the ECAPS bill, which is HR 1770, is scaled back a little bit from the big provider status bill that we've always asked for, because it's really focusing on those authorities that pharmacists were already performing and have proven ourselves that we can do through the COVID pandemic.
Yeah, it's one of those things that pharmacists are so well trained for and have such great accessibility, and is already within their scope of practice. It just makes sense for so many of those things. I can't tell you how many urgent care physicians must be begging for pharmacies to be able to take some of those, flu season overflow and just kind of level out that high demand that is such a natural fit for independent pharmacies.
And we heard a lot about that last year with the triple demic, because it was flu, RSV, and COVID all hitting at the same time. So yes, having pharmacists be available to help with that and be able to test and provide treatment if possible, I agree. I think it's a really big deal. And many times we found, especially during COVID, the physicians didn't want the sick patients in their practices. Sure. So one of the things we did, and I know many others did, was we would go do the test on the patient in the car or the parking lot, never let them in the door, so they're not walking in the door and infecting anybody else. But we still have the ability to determine what's wrong with them at that time and hopefully get them some treatment as well.
Yeah, well, most physicians have to be looking at those same efficiencies where you only want to do what only you can do. If you can delegate to another team member or to a partner in the healthcare community, it just makes so much sense.
Right.
So,
Right.
So we've talked a little bit about CPESN. We've talked a little bit about some great legislation that's going to make things better for Florida pharmacies. What about inside the walls of your pharmacy? What are you excited about moving forward with some of that, hopefully a little bit better landscape to work in? I know you've got a pharmacist out right now on maternity leave and business as usual, but what are you looking forward to? What are you excited about?
So, speaking of my clinical pharmacist that's out, her name is Tina. So we right before she went on maternity leave, we became accredited to do diabetes education and teach group classes. So we are very much looking forward to getting those started. So hopefully, in about a month when she comes back, that's going to be one of the first things that we do is start up doing group classes for diabetes education. And then we've also had access to a grant that is going to help us with education of patients for continuous glucose monitoring. So those are a couple of the big areas that we're excited to jump into and learn more about. And speaking of billing that we touched on earlier, trying to figure out the billing aspect is, that's probably been one of the most challenging things. And I think it's an area that all pharmacies are struggling with. Do you bill through the pharmacy system, or do you do through a medical billing platform? So I don't know if you're going to touch on that or not, well, but I think that Pioneer might have some answers, or they're coming soon. But I really do believe that that's an answer that all pharmacies are going to have to get to, is how to do the billing and do it effectively. That's especially been one of the hardest things that we've struggled with as we're looking to start this program, is making sure that we know how to get the bill to the payer. And in our case, Medicare is going to be the payer for the diabetes services. And just make sure that that is also efficient. So, but that's big time on our radar, looking to do that. As far as other services that we do in our pharmacy, we do compounding as well. So we've been looking to expand compounding also. Just again, getting away from that, being paid by a third party and having to deal
Yeah.
with all the issues there. So services that are more cash based are areas that we're looking to grow. And testing was great when it lasted, but testing is not a huge revenue generator right now because there's not a big need for it. It might grow again in the fall, but right now it's not there.
Yeah, yeah, absolutely. That's one of the interesting terms that is, you know, again, kind of surfacing is the cash-based model. Those uh, cash cash opportunities definitely seem to be, a focus for everybody. I thought it was really interesting. I heard a podcast the other day with Todd Urey where, he mentioned kind of that same uh, insurance element, in the automotive arena. You don't use your car insurance for an oil change. You use it basically as catastrophic coverage, and that cash-based model really kind of eliminates some of the hoops you have to jump through on the prescription side, and the patient isn't really affected at all. And in fact, their copay may be lower. So, yeah, it's kind of a bizarro world that, again, is stranger than fiction if you were trying to figure it all out from outside the industry.
It is. Yeah, it is. I think the hardest part is helping patients understand that it's not hurting them to pay outside of their insurance, so that it benefits them. So that's a lot of education too. Yeah, and then it can be tricky with when you're contracted with insurance. So maybe we'll stay away from that subject right now. But looking at other opportunities within our business that we can do that are revenue generating, but not specifically filling prescriptions through insurance, is an area that we are focusing on. And I think probably many other pharmacies are definitely looking to focus on.
For sure, for sure. Before I let you go, do you want to expand on your compounding a little bit? I'd love to hear kind of what your focus is there. Are you looking do you do a lot in, any specific area and a veterinary kind of focus, or where have you found a niche?
Yeah, so definitely in the veterinary area. And another thing that we have discovered that I really need to expand on is we actually have vets that are referring, or a local vet that's referring to us for CBD products too. So that's been interesting. And I realized the other day that it's only one, and I probably need to be out marketing that, because if they want to refer to us, that's great, and we're happy to take those referrals. But we have almost always done veterinary compounding. We do a lot of topical pain creams, and then some hormone compounding as well. Definitely some changes that have to be made in pharmacies to do some of those things, especially related to USB 800 and the implementation of that in the various states. But those are the areas that, I feel like there's probably more business to be had. I think that a lot of physicians probably refer outside of the community to pharmacies that are mail order because they've been marketed to. And I think that I need to do a better job of marketing to my community and getting back out there, reminding them what we can do for them.
Yeah, that's one of the things that I remember talking with Michael Muniz, and actually went with him on a meeting where he was able to meet with a lot of the people at a local hospital and explain how he could help cut readmissions and how we can help with adherence and that transition of care. And it wasn't as though he was there begging for business. He was there offering amazing solutions that helped them reach their goals. And it was such a positive reception that, just being known and just communicating with those members of your community can definitely have a huge impact on your pharmacy, but also on all of the metrics that organization is trying to keep an eye on as well.
Yeah, exactly.
Well, I'm going to let you get back to work at Bay Street. Thank you so much for being patient and joining us today. And I can't wait to hear about your diabetes program. Once that's up and rolling full steam, you'll have to check back in with me.
I'd be happy to. Yeah, we're very excited about it. And we think that we have a community that, a largely elderly community, that really, we fill so many diabetes medications. We just have a list of people that can't wait to get started with us. We've taught diabetes for years through a free class. So we have a pretty good pool of candidates to start with. And I'm looking forward to doing something that's more formal and bring some income in.
Yeah, more formal and most importantly, more profitable.
Yeah, exactly. Exactly.
Well, thanks so much.
All right. Thank you.
Thank you for listening to this episode of Beyond the Scripts, presented by the Catalyst Pharmacy Podcast. If you enjoyed this episode, please support our channel by liking, subscribing, and clicking the notification bell so that you'll be notified anytime we post new content. To stay up to date with all of the latest independent pharmacy news and content, follow Pioneer RX on your preferred social media platform.